All right, parents, listen up. The number of vaccines your children will need has changed.
Yes, the CDC reversing its guidance on what shots are required. Pix 11's Giovanni Diaz in the studio this morning to break it all down. Gio, this is good news for some, but really confusing for others.
A lot of concern.
Confusing, and it is a big deal because this is the first time that the CDC made such decisions in decades. They say the move will allow parents and pediatricians to have more say, but of course, it is causing some backlash, especially from health experts. This morning, vaccination changes are causing a stir among health experts.
There's not any new data that suggests the previous recommendations were wrong or should be changed.
For the first time in decades, the CDC is changing the guidance for what shots your child should get. Traditionally, kids are expected to get 17 shots, measles, polio, rubella, chickenpox, all included in the mix, and that's still required. But now, the federal government is ditching recommendations for 6 of them. Those include flu, rotavirus, hepatitis A and B, meningitis, and RSV. Those vaccinations will now be only recommended to kids with health conditions.
I think the change is driven by concern about patients having vaccine fatigue and also questions about confidence in vaccine recommendations.
The Department of Health and Human Services says they made their decision based on how other developed countries handle children's vaccination and also after reviewing scientific data behind it.
The recommendations around MMR, polio, DTaP, varicella, hepatitis B, and HIV, they all remain strongly recommended. The CDC makes recommendations on vaccines, but actual requirements are determined by individual states.
A lot for parents to process this morning. So the Trump administration said families will not lose access to any vaccines regardless of the change in recommendation there. But again, it's up to the states to decide how that's going to play out.